Today on the Root Cause Medicine podcast.
Telling a kid to practice some mindfulness exercise can be one of the toughest things. I mean, think about it with adult patients too. It is the thing as an adult, if your doctor tells you, look, you have to reduce your stress, you have to take this yoga class or do this. It is something that for patients, parents, I'm going to say even practitioners, we just put a little bit lower than the supplements or the diet and the lifestyle. And what I talk to kids and parents about is when we're engaging our vagus nerve, the benefit of feeling calm and relaxed, being able to focus, to me, that is a really beneficial side effect.
Hello there. I'm your host for today, Dr. Kate Kretzky, and we have an awesome interview ahead with Dr. Elisa Song. Dr. Elisa is a Stanford, NYU, and UCSF trained integrative pediatrician and pediatric functional medicine expert. More importantly, she says she's the mother to 2 thriving children, and she's dedicated her career to helping parents and practitioners bridge the gap between conventional and holistic pediatrics with an evidence-based, pediatrician-backed, and parent-approved approach. In this episode, we're going to go over what to do when your kid gets sick. Importantly, what to do, what not to do, and how you can address the top acute childhood concerns using an integrative approach. This includes the top 8, so things like the common crud that's going around, the colds, the flus, the respiratory illnesses, things that don't have a quick fix, but that you wish you could help your kid get better faster from. Things like earaches, eczema, even things like anxiety, you name it, Dr. Elisa is going to go through today some of her favorite interventions that every parent should know. Before we get started though, I want to talk to you about something that comes up pretty often on this podcast. And that, of course, is lab testing. You see, testing is one essential way to understand the root cause of an illness. If you're an integrative or functional medicine practitioner, chances are you're placing a ton of orders with a ton of different labs. The Root Cause Medicine podcast is created by Rupa Health. Rupa is the best way to order, manage, and track results from over 30 different labs in one single place for free. Thank goodness. No need to create and log into multiple portals ever again. If you're a practitioner, make sure you go sign up at rupahealth.com to create your free account today. Now, let's start the show. Do you have an antibiotic recovery protocol?
Yeah. I do. I have an entire chapter that's called literally what every parent and practitioner should know about antibiotics. And in that, I lay down a post-antibiotic microbiome recovery plan. Now, it's for antibiotic use, but I also list all of the other medications that can disrupt your gut microbiome just as much as antibiotics that we need to be aware of. So if your kids are on any non-steroidal anti-inflammatories like ibuprofen or Aleve, SSRI antidepressant medications, steroids, reflux medications, birth control pills, all of those can disrupt the gut microbiome. And I'm not saying to stop them. You want to work with your practitioner for that. But really, if they're helping, they're needed, great. But then understand the microbiome disruption that you need to stay on top of. Also understand the nutrient depletion that can occur with many of these, and just get the most benefit from your medications with the least side effects by understanding how to restore, replace nutrients that are being depleted and the microbiome that's getting disrupted.
So, and the protocol is something like take probiotics. Like, what are some of the things you recommend?
Yeah. So again, going back to the foundations, but the first thing is we know that some antibiotics actually can directly trigger leaky gut just by themselves. And so it's taking nutrients, extra added supplements that can help keep your gut lining intact. So zinc is really important. Zinc is one of the most common nutrient deficiencies in children. I'm guessing for adults too. But during that time, you probably need a little extra zinc. But I also have a list of zinc-rich foods to prioritize. Extra glutamine, bone broth, collagen, anything that's going to keep your gut lining a little bit more intact as well. And then most kids are deficient in their omega-3s. So taking an omega-3 supplement is very helpful as well. We want to take these, ideally you do this when you start your antibiotics and you continue for at least a month or 2. Now, probiotics, yes. I mean, I would love for your kids to get a ton of fermented foods in. In one study at Stanford, they compared fermented foods versus fiber and which had a bigger impact on the microbiome. And they both did. But what the researchers found was that fermented foods actually worked better at improving your microbial diversity. Fiber, of course, is awesome, right? But fiber was helped with the functioning and the short chain fatty acid production. So the function of your microbiome. So we need both, but getting fermented foods in, but then your kids may need to take a probiotic supplement. So, and that is a time where I do recommend. I mean, someone had asked me, in your 20 years of practice, what's one of the things that's changed the most? Well, what actually has changed the most is I used to say that everyone should take a probiotic every day, kid or adult. I used to think, oh, it's beneficial for us. Why not? Right? Most of us don't get enough fermented foods. I don't say that anymore because really the question we want to ask is, why do you want to take a probiotic? For what purpose? Right? And then we want to choose the probiotic strains that really have been studied to have that benefit. And so for restoring the gut microbiome, there are several strains that have been found to be helpful. And I list those in the book. But for now, taking a really kind of broad spectrum, like you'll probably find those in Claire Labs has a Therabiotic Complete that a lot of practitioners use. I like Orthobiotic because Orthobiotic has not just several really well-studied probiotic strains, but also a beneficial yeast probiotic called Saccharomyces boulardii that can be helpful to reduce antibiotic-induced diarrhea, so reduce the risk of C. diff overgrowth after antibiotics. So there are several others that I think would be good to take. And then just going back to your question a while ago about spores, it's interesting. So spores, I mean, they're relatively new probiotic kit on the block, although they've been around for quite a while now. But when I was starting out in functional medicine, there were no spore-based probiotics that were commercially available. There were some that were studied. And in India, there are a couple of bacillus strains that have been studied in children with some good results. But the rest, I mean, most of the spores don't have great pediatric studies. And it's not to say that they aren't going to be found to have benefit, but until they have really good, solid evidence in kids, they're not going to be something that I routinely recommend. Like I do want to see what is it good for, because we know there are different strains that are helpful for the skin, acne or eczema. There's different strains that are helpful for probiotics, are helpful for the immune system or for mental health or for metabolic health, blood sugar regulation. So I would love to see with these spores, well, what are the specific benefits for kids? Because then I know which child I would recommend them for.
Brilliant. Such a balanced approach. I love it. I can hear parents ordering this book right now just for this protocol. And for the parents who are at home thinking, well, my kid can't take pills, so I could never make those supplements work. Well, hang on. Dr. Song has gone through foods that are really high in these nutrients and food sources of these supplements per se, but also there are a lot of pediatric friendly supplements that are powdered or liquid. Like if you need something, you can find it in a form that your kiddo can take, and Dr. Song's going to help you discover that.
Yeah. I also have tips on how to get your child to take supplements, just because over the years, I mean, there's because you don't want to be sneaky, but you need to be creative sometimes, right?
Well, you even talked about a sippy cup that can help kids learn to swallow pills. I think I told a 20-year-old about it the other.
I'm with you because I did not know how to swallow a pill until probably I was 28. And even to this day, I mean, my kids can throw in like 4 or 5 pills and just one gulp. And for me, one pill, I'm drinking almost a whole glass of water. So I have total empathy for that.
Yeah, the tips are really great. Like, again, just so much practical, tactical information in here that I absolutely love. Let's dive into homeopathy a bit. And I think even before we dive in there, I was really struck by part of your story that isn't common, that I read and that I've heard you talk about in other interviews, where you actually went to be a children's rights lawyer before you became a doc, but you went to it sounds like a holistic pediatrics conference. Can you talk about that? I'd love to hear just how your approach developed.
Well, I mean, advocacy has always been a big part of my life, and kids. I always knew I wanted to work with kids. I mean, that was even heading off to college. I wanted to do something with kids, but being a doc wasn't really. I grew up in a medical household. My mom was an OBGYN. She was busy, 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 solo practitioner, delivering babies at all hours of the night, weekends, you name it, right? And so I saw that, I'm like, I don't know if that's the life for me. Yeah. But so when I went to Stanford as an undergrad, I wasn't sure what I was going to do. I mean, at first I thought maybe a teacher. I was really interested in public rights and civil rights. And we had an amazing law professor that I took a course from. So that's when I decided in my sophomore year, you know what, I think I'm going to be a lawyer. So I declared my major. I became a political science major with a public policy minor. And I was going to go to law school and work on Capitol Hill, go to DC and be a children's rights advocate. And I even spent 2 summers at the Children's Defense Fund lobbying to raise the Medicaid rates at which families were eligible for benefits. We worked on policies to help reduce teen pregnancies in underserved areas and worked with the Division of Adolescent and School Health with the CDC. So I loved it. I mean, I loved that. But then it dawned on me, I'm really not going to work with children. So I kind of had to think about that. And then that's when I stumbled upon this flyer, right? The life circumstances, there's always a reason. And this was back in, I think it was 1989. And so again, kind of quite a while ago. But I saw this flyer on this telephone pole and I thought, what is this? It was for the American Holistic Medical Association. And I mean, had never heard of holistic medicine. Right. And I thought, well, I don't know. It sounds kind of interesting. And I was always interested in spirituality. And so I went. I drove myself down to this convention center and my mind was blown. I mean, by this point, I was a junior and I was like, oh my gosh, wow, this holistic medicine. I heard from people who were just starting to get known, like Andrew Weil, Deepak Chopra, Joan Borisenko. And I remember calling my mom and I was like, Mom, this holistic medicine, this is pretty amazing. And I told her, I was like, you know what? I think I want to be a naturopathic doctor. I even called Bastyr, right? There was no online. We didn't have websites back then. I called Bastyr to get an application and she's like, what's that? And so she never discouraged me, but everyone that I was talking about my goals, my next steps were like, what is that? And I had so many people saying, look, you can do whatever you want. My mom would have supported anything, but they're like, maybe you want to go to medical school first and then you can think about that. So I didn't have the encouragement back then, right? And so I went to medical school and never really found anything I loved about conventional medicine. And so it was still always in my heart that I wanted to do something more integrative. And I knew fresh out of residency, that's the first thing I did. I opened up my integrative practice. I went out and I did additional training in acupuncture, functional medicine, homeopathy, essential oils. And I started my practice this way, which I am so blessed about that I didn't have to become immersed in the conventional world and then like pry myself out of that. I just started this way.
Wow. What did you learn at that conference? Was there one or two particular talks or a case study? Like, what was it that captivated you?
It wasn't even a case studies because it was really meant for consumers. It wasn't even for practitioners at that point, right? What sunk with me because also Marianne Williamson was there. And so Marianne Williamson and Joan Borisenko, I had always been really interested in. I didn't know it was called mind-body medicine, but that's the phrase that I kind of was like, oh, that is it. Because even in high school, I loved reading and I read Shakti Gawain's Creative Visualization, if for anyone listening who knows that, or like the Celestine Prophecy and all of that. And so this was like, wow, there really is something to the mind-body connection. And that can be medicine. And that can be something that we use for ourselves and for our patients to heal, which is why for me, apart from the microbiome, I mean, the microbiome and the vagus nerve are my two favorite ever topics, to talk about with children. Because I think if kids can master their vagus nerve and microbiomes, there's nothing that they can't accomplish. I mean, they're set for life in terms of health and mental well-being and just being able to thrive. It is interesting because then after residency, I stumbled upon this food as medicine conference that was for practitioners. And that again was like this, whoa, food matters. Like it matters what you put in your mouth for your health. And that was actually in maybe 2001. And I went to Berkeley. I mean, I'm here in the San Francisco Bay Area and it was at this hotel called the Claremont. And that's another thing. I literally stumbled upon this flyer again for this conference because I was going to grad school to get my master's in public policy because I'm like, I don't see anything in conventional medicine I love. Let me go back to my advocacy roots and so kind of go back, right? But I saw this flyer and I went. And who did I hear? A very young Mark Hyman talking about food as medicine and Dr. James Gordon talking about mind-body medicine. And then I was like, this is why I went to medical school, right? Like this is where I'm going to find what I love to do. And so that's when I did the whole IFM training, and here I am.
Wow, I'm so thankful. And those little moments of synchronicity, seeing a flyer, thank God for that. Because now you're here impacting, I mean, I don't even know how many thousands of kids you must have helped already.
Well, and there's a ripple effect, right? Because once a parent knows and they talk to their friends and their parents and then practitioners, it's all about empowering. And then just the word spreads, because once you know, you can't unknow. And once you know, you want more people to know, right?
It's so cool to me to when people embraced the mind body medicine and started practicing it. And this was before we had the ACEs study. So, which is really only in the past 20 years that we know all that adverse childhood events and early life stress increase your risk for chronic disease. But before we had that evidence, you already knew that and you were doing the mind body work. And I love that you say in your book, like stress for our kids is okay. There's a certain amount of stress that's all right. It motivates you. It can inspire you to change and work hard. But being resilient in the face of stress is what we have to help our kids develop, because that's what buffers them from all the negative effects. So, I mean, the word resilience is on the front of your book. Tell us how you incorporate the vagus nerve in your practice. You have some really cool practices that I think most folks will think, I can't get my 3-year-old to meditate, but you really beautifully weave that into, it sounds like, every treatment plan with your kids.
I mean, I discuss it and it's so important. And you're right. Telling a kid to practice some mindfulness exercise can be one of the toughest things. I mean, think about it with adult patients too, right? It is the thing as an adult, if your doctor tells you, look, you have to reduce your stress, you have to take this yoga class or do this. It is something that for patients, parents, I'm going to say even practitioners, we just put a little bit lower, right, than the supplements or the diet and the lifestyle, right? And what I talk to kids and parents about is when we're engaging our vagus nerve, the benefit of feeling calm and relaxed, being able to focus, to me, that is a really beneficial side effect. That is like, oh, I'm so glad you have that. And the real reason we work on our vagus nerve is because it reduces inflammation. It regulates your blood sugar. It helps you recover from illnesses faster. It supports your mitochondria and your metabolic health and your hormones. And it actually improves your gut microbiome independent of diet. I mean, that is fascinating, right? So we might think, oh, it's nice to do if I have the time, but this is like, you know what? No, this is the thing you make the time for, because otherwise we're not going to thrive as much as we can. And the reason the vagus nerve takes up an entire chapter in my book, it is chapter 6, and it's called Breathe is the name of the chapter, because we have to breathe every single day. So this is not an add-on. Like, I'm not telling you guys do something extra. What I am saying is let's learn how to breathe in a way that engages our vagus nerve. So instead of breathing with our shoulders up by our ears, only with the top third of our lungs shallowly, so we're staying physiologically in that fight or flight sympathetic state, we got to keep our shoulders down. Imagine there's a balloon in your belly that's inflating slowly as you inhale and deflating slowly as you exhale while your chest stays still. If we can do that throughout the day, whether you're sitting there getting stressed about an exam you're about to take, or you're stuck in traffic and you're really stressed, just calm, 10 slow belly breaths, diaphragmatic breathing. You can count and do the 4-7-8 breathing if you want. You can do the box breathing. Don't stress about that though, because I have some parents who kind of stress about, like, wait, do I inhale for 4, or do I exhale for 4, and then do I hold for 7? Like, it's not meant to be stressful, right? You just the idea, just slowly in, slowly out. And that engages your vagus nerve immediately and helps you just really move forward with whatever's stressful anyway, but it also does in that moment. Because what does stress do? I mean, stress, psychological stress, creates inflammation, as much inflammation as an infection or physiologic stress. Psychological stress raises our blood sugar, right? Psychological stress increases our cortisol. So all of these things, that if our blood sugar stays raised, our cortisol stays raised, right? Our inflammation levels stay raised. If we're in a chronic state of stress, well, guess what? That's going to lead to problems down the road, right? Or maybe if you have a chronic illness, it's going to make it worse. So if we understand that engaging your vagus nerve actually does reduce all of those things, and as a byproduct, you feel good, then we know, okay, this is truly, really probably the best prescription, most important prescription that you have.
Part of what I love about the medicines you talk about is that many of them are free or cheap, and breathing is free. So when we think about how do we democratize access to good medicine, to changing your microbiome, I mean, breathing is something every single person can do. And I love that you have a whole chapter about vagus nerve health, like for that reason.
It is true. Like all these things that we can do. I mean, eating, you have to buy the food, but if we just shift things in a way, it doesn't have to cost more. You can buy organic frozen foods and canned beans and all the things. And so, but the way we breathe and move our bodies and sleep, I mean, we do have a choice there. And that is how, as you said, I mean, if we really want to create a space for health equity, we have to understand that starts with nutrition equity and just being able to do all of these things and empower. And of course, I mean, I do have in the book resources for if you would like to buy a device to engage your vagus nerve. There are certainly ones that are available, right? And I list the ones that are, there aren't many that are really approved for use in kids, but there are some. But you know what? If your device runs out of batteries or breaks down, guess what? You still got to know how to do the breathing and the vagus nerve engagement on your own because you don't want to rely on the devices.
Mm-hmm. Is there an example of a kiddo who maybe used this type of breathing or vagus nerve interventions predominantly, who was able to shift their health outcome?
A couple of kids. I mean, I'll just give a really quick example of this one kiddo who used it. We were doing acupuncture for his bedwetting, which can be very helpful, right? He tended to be a little bit of a higher anxiety kid anyway, but you talk to kids about acupuncture needles and then it's like, woo, the anxiety goes way up, right?
Sometimes even adults.
Yes, yeah. So I don't call them needles, by the way. I call them my magic sticks or whatever you want to call them, but I don't call them needles, right? So anyhow, so he came in, he was probably maybe 8 or 9 at the time. And he was very motivated. Like he wanted to try the acupuncture because he tried the bedwetting alarms and some of the things that hadn't worked. So he was motivated, but he was also very nervous about it. And so one of the tools that can really help kids to engage their vagus nerve if they need a little outside direction is heart math. So it's like a biofeedback device for listeners where you put an ear clip on one ear and it senses something called heart rate variability. So it senses your vagus nerve functioning. And you just look at this rainbow flower expanding and contracting. And as it's expanding, you slow breath in and exhale as it's contracting. And you can see a green, blue, or red dot if you're in coherence or not, if you're in a flow state, if your vagus nerve is functioning well. And so he used that. He pulled that. He's like, okay, I want to use this, Dr. Song. So he pulled it out. And started just breathing and getting into the green coherence. His vagus nerve is activated. And he just looked at that and was able to do the entire acupuncture session, just calmly and staying in that state of coherence, which was great. Great. Now, another kiddo who doing all the functional medicine work, healing his gut and looking at food sensitivities, and he actually had some underlying mitochondrial issues, but his main issue was eczema. So just really like itchy all over, really hot, scabby red ankles. And so we got him to a place where he was barely, I mean, maybe occasionally he would need a touch of steroid cream. So his skin was really smooth. Biggest flare though, anytime he was stressed, he'd start flaring. Right. And we see that in kids, right? When you're stressed or have a lot of anxiety, that can flare eczema, that can flare asthma, that can flare autoimmune conditions, right? And that doesn't mean, it's just in your head. That tells us the power of our emotional state to impact how our immune system is functioning. So he had to really work through a lot of that. And the way he worked through that was using cognitive behavioral tools. Right. I have some favorite books by Don Huebner, the What to Do books, what to do when you worry too much, what to do when your temper flares. So he learned cognitive behavioral tools, which has been shown to improve heart rate variability and vagus nerve function, to manage those times where his stress was amping up, or when he was getting flustered or angry at his little sister, and that would flare things. And he learned to regulate his breath and just slow his breathing down. And that tool for him kept his eczema at bay. It's sort of like the dandelions and the orchids. It's when we go through these stressful times and we can overcome, it makes us hardier and more resilient, which is why we don't want to shield our kids from every single thing. But he now, as a young adult, has the tools to manage stressful situations that a lot of his friends never learned because they didn't have to go through that, right? So I let kids know it might feel like it kind of sucks that I have to go through this, but look, you will get so many gifts to manage that your friends do not have the opportunity.
Yeah. We would talk about that in my practice too. I think being sick when you're young is so stressful because it can feel like you're alone, or it can feel like, what's wrong with me? All my friends are normal, and here I am. I have to go to all these doctors. And it's like everybody has their decade. For you, it's your teens or your preteens. For your friends, it's going to be their 40s, 50s, 60s. Like, you are learning now all of the keys to health that are going to set up the rest of your life to be amazing. So I love that you have that perspective. Okay, I can't let you go without asking you some like quick, practical questions. We had a lot of questions for you on Instagram. Biggest ones were about ear infections and adenoids. So can you walk us through, like, kiddos pulling on their ear, they get a ton of ear infections, they've taken a ton of antibiotics, like they show up to your office, the parents want help. What's the first thing you do?
Yeah. So the first thing that parents should be aware is that the American Academy of Pediatrics guidelines, okay, these are their official AAP guidelines, that for the vast majority of kids, the recommendation is to wait and watch for 72 hours before prescribing antibiotics. So just know that, because that is unfortunately not happening in clinical practice. And this guideline, the revision was written, I believe, in 2013. So it's not a new guideline, right? So that is a recommendation. Now, in the meantime, while you're waiting and watching though, right, you might ask your doc, what can I do in the meantime? There's been no evidence that Benadryl or Sudafed make any difference, right? But that's often our go-to in conventional pediatrics. We know that if your kid also has a fever, giving Tylenol or ibuprofen to reduce the fever artificially has been shown in some studies to keep kids sicker for longer. And in some studies, actually shed more virus, meaning make your kids more contagious while they're on that fever reducer, right? So there are going to be times, and if your kid is miserable, okay, there's a time for that ibuprofen, right? Or there's a time for that acetaminophen. We want to make sure that we keep your microbiome healthy with the ibuprofen, or replace glutathione if you're using Tylenol. But yet, there are so many things we can do to even hopefully prevent that. So the first thing I would tell patients to do, there's three things. One of them is the garlic ear oil. There's a garlic ear oil with mullein, St. John's wort. I know parents are going to say, what's the brand? There's one called, I believe the one that we carry is by Herb Farm, Pharm, Herb Farm. So that one has the exact combination that was used in the studies to find faster pain relief than even an anesthetic, like a medicated anesthetic drop. And it can kill viruses and bacteria. And most ear infections are a combination of both, right? And so it'll help kill whatever microorganisms are causing that ear infection to begin with. So that is not orally, but you do the ear drops, right? In your ear, you warm them up. You put 3 or 4 drops into the ear, hold your head to the side. You can put a little cotton ball in the ear and just let it sit there, and do that a few times a day, 3, 4 times a day. Also, homeopathic ferrum phosphoricum. So ferrum phosphoricum is a homeopathic remedy that is really good for low-grade fevers, very nonspecific inflammation, but it also targets the eustachian tube. So the ear canal connecting your eardrum to the back of your throat, and helps that to drain the fluid that is collecting and contributing to that ear infection and the pain. It's also a great one if you have trouble clearing your ears on airplanes, or let's say when you're diving or swimming. Ferrum phosphoricum is the one to take for that. So ferrum phosphoricum, you just automatically start, along with you can individualize other homeopathic remedies. And then as far as herbal medicines go, there is a syrup. It's called over the counter. You can find it as Umcka, UMCKA, Umcka cold care syrup. It's a cherry flavored non-alcoholic syrup. They have drops and chewables as well. And in practitioners' offices, in our office, it's called V Clear by Integrative Therapeutics. Same thing. Now, what is it? It has an herb called Pelargonium sidoides, long word, but Pelargonium sidoides, it's an African bush herb that has been found to have amazing antimicrobial properties against a number of different respiratory viruses, including the common cold adenoviruses, rhinoviruses, coronaviruses, herpes viruses, Coxsackie, which causes hand, foot, and mouth, even some bacteria like strep and staph, and also influenza virus, RSV. I mean, just this broad antimicrobial action, so that's actually one of my go-tos when you have anything, what I call the winter crud, right? Because the crud is your kid gets sick. You have no idea what it is. I mean, test negative for flu and COVID and whatever. It doesn't matter what it is. Just start the V Clear or the UMCA, because chances are it's going to have some activity against whatever your child is fighting. And then you do all the other things.
Wow. I wish it was in the water supply.
I know, right? I love it. We literally carry bottles of it wherever we travel on vacation.
Yeah, I bet. That's great. And how empowering too. You have so many guidelines in the book of like when to worry, when to call, that I think this book just helps parents feel safe and also really empowered in that really tough in-between period where you're being told there's nothing we can do for you for several more days. Your kid is in pain and you're wondering like, how do I help them now? I mean, you talked about a case study in your book where all you did for a kid with a severe ear infection was homeopathy. And within a few minutes, he felt better.
Oh yeah, that was, I mean, it's the kind of thing, the stories I say in the book, I put them there because like really and truly, if I hadn't been there, I don't think I would have believed it, right? To literally see like a little kiddo with hives in the office, give him some homeopathic Apis mellifica while I'm still going to the back closet to get some Benadryl, right? Like it's not either or, right? But what I had most readily available was the homeopathic Apis mellifica. And then literally just in the time I went back and got the Benadryl and came out, the hives that were started on his face and were marching down his body were literally reversing up his body and disappearing. And so I'm like, okay. And he never ended up needing Benadryl.
See, this is what we hope for as parents, especially like the low side effect interventions can be so useful to start, especially you can have this stuff on hand at home. Whereas it's a lot, like to get your kid to the doctor, to get antibiotics or steroids, like it's expensive. It's time out of your day. You might have to take off work. You're taking them out of school. I really love that you're empowering parents with some of these in-between options. What do you think about adenoids and getting tonsils out? We had a ton of parents ask about that in the comments. Like, are you a fan of getting tonsils out?
So I would say it depends. My son had his tonsils out. Okay. Now, for him, so remember I said way long in the beginning of our interview that both of my kids had antibiotics when they were under 6 weeks of age. And so my son, he had antibiotics because there was strep going on. We were at a family wedding and there was just strep going around. And I looked down at him and he was about 4.5 weeks of age. And he had this green gunk just coming out of his ear. No fever. He was acting fine. And I'm like, At first I thought, ooh, I don't know, is that some wax? I mean, how does a 4-week-old have wax? So I wiped it away, but it kept coming out. So I finally went to see my friend who was one of the urgent care docs because I didn't want to be responsible for making decisions for my 4-week-old baby. And I asked her to send a culture. And sure enough, it grew out group A strep. And we both were like, we've never seen this before. Like we've never seen a baby with group A strep. Obviously his eardrum had ruptured and he wasn't screaming with an earache pain. So he did get the antibiotics, right? But what's fascinating for him is before his tonsils were out, he was a throat kid, never tested positive for strep. And when his tonsils would be swollen, but his tonsils grew huge and they're what we call kissing tonsils. So they're touching in the middle. And even when he would sit upright in his car seat falling asleep, not even to the side or like this, he would be sitting upright and he would be like gasping and like, so I tried all the things and I tested him for environmental allergies. So what I would do for a Test for environmental allergies, right? Just make sure that there's not like a dust mite, pollen, grass, something that you can control in your environment. Test for food allergies, like actual IgE food allergies, because sometimes they don't show up as hives or anaphylactic symptoms. And also check for food sensitivities, which are more an indication for the listeners of a leaky gut, because those are going to be more non-IgE mediated. Sometimes IgG antibodies, and we have a variety of tests, right? And so we did all that. Right. And nothing really showed up for me to work on. I mean, sometimes you can say, oh, yeah, it's normal. But then it's also like, oh, well, now what do I do? Right. And so then as we looked at his tonsils, I mean, he wasn't eating much gluten or dairy, but we cut everything out and really went very clean. And I started him on some homeopathy and they got a little smaller, but he still had such apnea that it was time. When there's significant sleep apnea, you have to think about that impact as well. So we did do the whole tonsillectomy and surgery. I did give him homeopathic arnica and phosphorus beforehand to reduce the bleeding complications and some of the pain afterwards. And he did great with it. But the surgeon said we sent off some of the tonsil tissue for pathology. And they said it was just, I mean, I don't want to gross people out, clearly there was infection hiding in those tonsils, right? Even though he never tested for strep. I think that strep when he was a baby just set that stage up. And he, interestingly, when he had COVID way in the early days of the pandemic, he had these neuropsychiatric symptoms that look very much like PANDAS, right? So for the listeners, pediatric acute onset neuropsychiatric disorders associated with strep. We know that COVID and other infections like Lyme and influenza can trigger these symptoms as well. But so he was hospitalized in the early days. This was like March of 2020, right? When we didn't know what the heck was going on. And we certainly didn't know how COVID manifested in kids. And he had these very unusual, this eye rolling tic, personality change, hallucinations. I mean, it frightened the heck out of me, right? And so I think for him, he had that strep from so long ago as a baby. And so there was this thing that happened with that. And so that's another indication that I would recommend getting tonsils out is if you have a child who has PANDAS, recurrent strep infections, and they're having behavioral neuropsychiatric manifestations, sometimes the tonsils are a hidden reservoir for the strep. So I would highly consider discussing that with an ENT doctor who is familiar with PANDAS, right? Hopefully you have one there. Right. But my first choice would be to do all the work because sometimes there's, dust mite allergy, you get that under control. There is an egg sensitivity, you remove that, you heal the leaky gut, and the tonsils shrink. And you don't have to go the tonsillectomy route because, of course, if we can avoid the surgery, we can. So there's a lot that we can do for a tonsillectomy because tonsils are your lymph tissue. They are part of your immune system. So the question we always have to ask is, why are they enlarged? What is causing your child's tonsils to be inflamed and enlarged? Is it an environmental toxin? Is it an allergen? Whatever it is. I mean, we just have to do some digging. And sometimes you don't find an answer, but sometimes we do.
And adenoids are the same, right? It's like kind of tonsils of the nose is how I think.
That's right. Absolutely. The adenoids you just can't see when you look in, but the adenoids are right behind the tonsils. And usually when your tonsils are enlarged, your adenoids go hand in hand. There's something up here in your child's head space. And sometimes it's a low-level sinus infection that just keeps draining. So anyhow, it's still, adenoids are exactly the same.
It's interesting. In med school, my tonsils were enlarged. They've been chronically enlarged forever. I was just like, I guess this is just how I am. And I was lucky enough to have a naturopathic doctor test me for food allergies. I was allergic to eggs, which explained actually a lot of my other symptoms. But taking the eggs out, my tonsils went back to normal. Like you can't even see them anymore. And again, it's this type of thing where you hear this. And as a parent, if you haven't experienced any other parents with kids who've been able to shrink their tonsils, you might just think, well, that's not possible. But it's totally possible. But it depends if you find a root cause that can be fixed. But there are things you can do. So I'm glad you mentioned that. Thank you so much. With the allergies question, because one of the medications that I was glad you touched on that alters the microbiome are allergy medications, like Zyrtec.
Yeah, our antihistamines.
Yeah. So, what are some natural things for allergies that you recommend parents consider if either they're already doing everything, right, and their kid's still miserable in the spring, or maybe their kid can't stand shots, they don't know what to do. They're like, is there anything I can do before I go get this kid treated?
Yeah. Well, and here's the thing, the way I think about using an over-the-counter antihistamine, it's not a never ever. I mean, my daughter, she got the pollen allergies from my husband, and she plays soccer on grass fields, and she refs on grass field, and so it can be rough sometimes, right? So there are, as far as histamine release goes, when we're thinking about histamine in the body, we just have to remember we have histamine receptors on every single cell in our body. And the histamine receptors that typically cause the classic allergy symptoms, the itchy eyes, the itchy nose, runny nose, sneezing, postnasal drip, those are histamine type 1 receptors. And that's what Zyrtec, Claritin, Allegra are. They are histamine type 1 blockers. And so those can help reduce the amount of histamine and the impact of the histamine that is currently circulating. They do nothing to reduce the amount of histamine that is released in the first place. So I look at it as kind of a multi-step process. Now, if you're suffering from really bad allergies right now, then yes, you can take the Zyrtec to mop up the histamine that's already around. But we don't want to keep mopping up. We want to prevent more histamine from being released. And that is where using your natural antihistamines, mast cell stabilizers to reduce further histamine release can be really helpful. So you're overlapping. You do the Zyrtec for a little bit, maybe for a week or so. In that week, you're adding things like quercetin, which is a natural mast cell stabilizer that's found in St. John's wort. It's found in the red peel of apples or onions or capers or spinach. And so we up the foods that are high in quercetin. I also take a quercetin supplement. You can also do vitamin C. The adult dosage for vitamin C that's been found to stabilize mast cells and reduce histamine is 2,000 milligrams. So you just dose that appropriately for kids. Zinc has been found to also stabilize mast cells and even omega 3s. And there are certain fish oils, probiotics. So omega 3 fish oils, but also certain probiotics that have been found to reduce histamine problems. So we layer that in. And then after a week, you can try taking the Zyrtec off or the Allegra off. And hopefully by that time, there's enough histamine stabilization that now your symptoms are better. You're not exploding with histamine every time you encounter a grain of pollen and you don't need the Zyrtec anymore. And then, of course, while you're taking the Zyrtec, I would recommend taking a probiotic while you have allergies and doing all the things to protect your gut. So there's a lot of things we can do. And then from a homeopathic standpoint, I mentioned Apis mellifica for hives. Well, Apis mellifica is considered the homeopathic antihistamine. So that's a great one to add. In fact, there's a homeopathic combination remedy called Allergy Calm by Boron. Boron is one of the largest homeopathic manufacturers in the world, and they have a combination Allergy Calm that has Apis mellifica in it, and then also other homeopathic remedies that are good for the itchy nose or the watery eyes or specific symptoms.
Wow, this is awesome. Guys, one of the things that you'll love about Dr. Song's book is that there are, pages and pages of information about the different homeopathic remedies you can choose for over 30 different common conditions in childhood.
Oh, well, so I was gonna say that the part 4, it is that A to Z guide of the most common acute conditions and how I use diet and lifestyle supplements, essential oils, acupressure points, homeopathy for them. And in the back, I have a diagram, a cute little diagram with showing you where the acupuncture points are. There's also a list of the top essential oils that I use by age range and the safety profiles for which age range and how to dilute them for each age range. And even the homeopathic remedies are listed in the back from A to Z, just so you can kind of quickly scan through. Oh, I remember she mentioned that Nux vomica is really helpful for like feeling motion sick and nauseous, but I can't remember what else it's good for. So you can go to the back and see, oh, okay, next one. Wow, okay, that's one also that's really good for really stuffy, congested nose during the day, but like really runny, watery nose in the morning. So, I mean, it's all there for you as a resource and that one It's just meant to be your bedside, like just have it on hand. So, if your kid wakes up with an earache, you can go straight to the earache section, but you don't have to read that where you just know it's there so you can look at whenever you need.
So useful. I think so many people are going to find this useful in the middle of the night for sure. But all throughout, I mean, this is not just for little kids. You can use this for, you talk about acne in teenagers and mood issues. We have to have a whole other talk with you on pandas and anxiety and mental health. I think at some point we need to bring you back for that. But I want to just give you a chance. I want to thank you for being so generous with your time here, and also so generous with your time in writing this, because I know this was a labor of love, and I am so grateful that you did it. And I want to give you a chance here to say anything that hasn't been said, or just to talk to the folks who are listening.
The message that I just want that parents and kids to know is that it's really never too late. It's never too late to take your health into your own hands and to empower yourself to move forward. No matter where in your health journey you are right now, we can always move forward. We can always restore your microbiome. And that's why I wrote the book. It's a message of hope that I want people to take.
I got that. I know everyone else is going to get it too. That message of hope. Thank you so much, Dr. Song, for being with us today.
Oh, thanks for having me.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.